Hi, my name is Madison Green. I'm a student at US University. I'm taking MSN 572 with Dr. Janice Linton, and I'm going to begin my comprehensive assessment and medical history for my patient today. Here is the beginning of our video for wall scan. And here is my patient. So I'm with my patient today, Mr. JB. Can you please tell me why you're here today?
I'm here for a full medical assessment. I haven't had a physical assessment done in many years, so I just got a new job and needed to get an assessment done.
Nice. Okay, well, welcome to the office. I'm glad that you came in and that we're able to get you established here. Do you have any current concerns with your health care?
No.
Okay. Have you ever been diagnosed with anything?
Plaque psoriasis about 6 years ago.
Okay. Did you just notice that you had some markings on your skin, or how did that start for you?
Yeah, I started getting dry, flaky spots on my elbows, some on my forehead, and many other places on my body, and went to the emergency room, and they had said that that's what I have. So they had gave me hydro or some cream, steroid cream for it that I put on twice a day.
Okay, that sounds
and
good.
it gets inflamed, but
Okay.
Besides that, it's relatively mild.
Okay, good. So when you put the cream on, you did notice that the patches of the psoriasis got better for you?
Not quickly.
Okay.
I mean, not
a ton, but
it's
did
more,
help
It's
some.
more irritation. It doesn't take it away.
Okay, all right, sounds good. Okay, and how old are you today currently? When's your date of birth?
October 27th, 1995.
Okay, perfect. And you said you don't have any allergies?
No.
Okay. What's your home life like? Do you have any siblings? Are your parents still alive?
I have two siblings. I have an older brother and a younger sister, and then both my parents are still alive.
Okay, great. Do you see your parents often?
Yeah.
Yeah?
Once a week.
All right, that's good. How's your parents' health?
My dad is overweight. He has high blood pressure. And my mom is in fairly good health, but also has high blood pressure.
Okay. Do you know if they take any medication for those?
I'm sure they do. I don't ask them, but I'm sure they do.
And you mentioned that your dad is overweight. Has he done anything for that? Is he doing anything for that?
He had lap band surgery.
He did? Okay.
15 years ago.
Okay. Has he had any surgeries recently?
He had hernia surgery
Oh, wow, that's significant.
recently,
Yeah,
a couple weeks ago,
Okay.
about a month ago.
that's a serious surgery.
Yeah.
Any family history of reactions to anesthesia in your family?
Not that I know of.
Okay, that's good. Any drug or alcohol use in the family?
I don't know. Does one person qualify as the family? I would say.
One person does not qualify as the
No,
family
I-
generally, no.
I don't know. My mom's side's pretty crazy, so I would say
Okay.
there's probably alcoholism on my mom's side, but
Okay.
I don't
Some alcohol use,
know half
okay.
of those relatives.
Do you drink alcohol?
Yes.
Okay.
Socially.
Socially, okay. How often do you drink?
Once a week, once or twice a week, depending on what's going on.
Okay, sounds good. When you are drinking hard liquor, beer?
Both.
Both? Okay. So about how many drinks every time you drink?
Depends on the night.
Okay. All right. So you sound like a fun time, huh? How would you describe your overall health?
Overall, good.
Overall good. Okay. So you'd say you're generally healthy.
Yes.
Have you ever been hospitalized before?
No.
No. Have you ever had any surgeries or anything like that?
I had a fracture on my hand. I had surgery on that
What year was that?
7 years ago, I think.
7 years ago? Okay. So like 2016. About then.
Something like that.
Okay. And it was a right hand fracture, you
Yeah.
said? Okay. How'd you do that one?
I got into a fight on New Year's Eve.
Oh, man. Okay. How about your vaccines? Are you currently up to date on all of your immunizations and vaccines, like since childhood?
I haven't got a vaccine since I was in school and I had to get them.
Okay.
So,
But you feel that you were up to date because you had all the ones that qualified for you to go to school?
correct.
Okay, sounds good. How about your COVID vaccine? Did you get a COVID vaccine?
Oh, no.
No, you did not? Okay, sounds good. Personal preference?
Absolutely.
All right, sounds good. And as far as your health history with your parents, you mentioned some high blood pressure. Does anybody else in your family have high blood pressure? Maybe your grandparents?
Probably my grandpa.
Okay.
And I don't Probably my grandma too. I don't know.
Grandma as well. What about, you mentioned that you have the plaque psoriasis. Does anybody in your family have any other skin conditions or any other joint conditions like arthritis or anything like that?
My grandma has arthritis.
Okay.
In her like foot and ankle.
Okay.
I'm sure other places too.
Okay. Do you feel any aches or pains in your body anywhere?
Sometimes.
Like where?
Like in my knees and my ankle, like my joints.
Okay. Do you take anything for that?
Not currently.
Okay. And how about your siblings' health? What's their health like?
My sister Hannah she's gluten intolerant.
Oh wow, that's
So,
a hard diet to keep up with. Yeah.
Besides that, I think everyone's good. My brother Caleb, he doesn't have any health issues that I know about.
Okay.
Currently.
Sounds good. And then we spoke about the family history with alcohol. How about drug use? Do you smoke cigarettes or use any recreational drugs?
No.
Okay. So you said no to cigarettes. What about cigars or vapes or anything like that?
Cigars every once in a while. I wouldn't say I smoke them.
Okay.
If we're at a wedding or something.
Okay,
There's a
so a
cigar
special
bar,
occasion.
I'll have a cigar.
Okay, sounds good. And what about your marital status? Are you married, single? Are you in a relationship?
Marital status, I'm single, but I am in a relationship.
Okay, sounds good. So we're going to talk about your sexual health history at this point. I know these things can be a sensitive topic, but we're going to talk about your sexual health just to make sure that you're doing good and feel like everything is okay for you. So I know that you mentioned that you have a girlfriend. Do you just have one sex partner at this time?
I do.
Okay, you're in a monogamous relationship with one female partner? Okay, sounds good. Have you ever had any STDs or STIs?
I have.
Okay. What year did you have an STI?
2014.
2014? Okay. And you received treatment for that?
I did.
Okay, perfect. And then did you ever take a test after that to make sure that it was completely gone before you remained sexually active?
No.
No? Okay. You had symptoms with that infection and they went away completely after you took a course of antibiotics?
Yep, they gave me antibiotic and antifungal. They didn't know. They said it was either this or the other. So they said take 2 of these pills and 2 of these pills, and either way, it's going to kill it off. So you'll be fine in 2 days. 3 days.
Okay, sounds good. How about with your partner? Do you guys practice safe sex? Do you use condoms, birth control, anything like that?
Birth control.
Okay, birth control. And how about your partner? Do you guys have a good relationship? Any intimate partner violence? Do you feel safe at home?
I sometimes feel safe.
Sometimes feel safe at home. Okay.
I feel safe at home.
You feel safe at home. Okay, good. I'm glad to hear that. And safety in your household. Who lives in your household with you?
My dad.
In your immediate household that you live in, who lives with you?
My current home.
Yes.
My girlfriend.
Yes. Okay, so you don't live with your family?
No.
Okay, so you live with just your girlfriend in your house. Do you have any pets or animals?
2 dogs.
Okay, sounds good. And for your visit today, you said that you just got a new job. So you said that you're working in sales. Have you always worked in sales?
For the past 7 years or so.
7 years, okay. So you love it. You're passionate about your job?
Depends on the day.
Depends on the day. Okay, what's your work schedule like?
7 in the morning to about 7 at night.
Oh wow, those are really long hours. Do you feel like you're well rested for work and you have a good sleep schedule and you're taking care of yourself inside and outside of work since you're spending so much time at work?
Probably not.
Probably not, okay. How much on average would you say that you sleep per night?
5-6 hours.
Oh, that is definitely not enough. We have to work on that sleep schedule for you.
Tell my boss.
Yeah, recommended that you get at least 7 to 8 hours of sleep a night. How about your diet? Do you feel like you're eating and drinking, as you should? Do you have any dietary restrictions, anything like that? No?
Diet's fine.
Diet's fine. Okay, no allergy restrictions, no preferences, no cultural limitations?
No.
Anything like that? Okay, sounds good. And as far as your sleep schedule, do you feel like your sleep schedule is affecting your day-to-day life because you're tired, or do you feel like you're functioning at full capacity?
No, I would say my work schedule is affecting my sleep schedule.
You're a funny guy. All right. And then how about for spiritual affiliation? You said you don't have any cultural limitations for your diet, but do you practice any religion or anything like that?
Christianity.
Christianity. Okay.
Sure, that's
Do you
the family health history.
do you attend a church locally?
I do.
Okay, sounds good. And how about your family? Does your family attend church with you?
My grandpa is a pastor of the church.
Oh wow, that's a cool dynamic. Okay.
My dad's his praise and worship leader. My mom is the head of the children's class.
Nice.
So yeah, everyone's pretty active.
So the whole family, it's a family affair at church. Okay, and then I'd also like to just discuss some like usual safety that we discuss with patients, which includes safe seatbelt use. It also is going to include us asking you about drinking and driving, and if you own any guns or weapons in the home. Do any of those apply to you? Do you own any guns or weapons?
No.
No guns or weapons in the household, okay. And then do you wear your seatbelt when you're driving a vehicle?
Every time.
All right, perfect. And how about we avoid drinking and driving?
We do avoid that.
Okay, good. And then in your home that you said is safe, do you have running water, electricity, air conditioning, those type of things?
Yes.
Okay, that's good. And then do you have a working fire alarm and carbon monoxide detector?
Not in the home. Fire alarm. We have a fire safety things, I guess.
Okay, the smoke detectors.
Yeah, that's not a fire alarm.
Okay.
Smoke detector.
Smoke detectors.
Sure.
Okay, good. And then we are going to now review just a general head-to-toe consensus. I'm going to ask you some questions, and you're going to answer them for me to the best of your ability. I know that some of these questions can be in-depth or difficult if you've never been asked them before, so just to the best of your ability, try answering them, okay? So I'd like to just start by asking you, you said generally you feel good on a day-to-day basis. That seems right?
Yep.
So that means, you don't feel sick waking up every day, no fever, chills, diarrhea, vomiting, anything like that? Have you had any recent unexplained weight loss or weight loss without trying or loss of appetite? No? How would you describe your diet? Are you eating like 3 meals a day? Are you more of a snacker? How would you describe your eating habits?
Usually not eating till afternoon, so don't eat breakfast, and then typically majority of calories are consumed in the evening.
In the evening, okay, so you're a nighttime snacker.
Yeah.
So busy during the day you have to eat everything mostly at night, but
Yeah.
glad to hear that you're
They
at
call
least eating.
intermittent fasting.
Yes,
but
okay,
yeah.
okay. So, but you are eating at least lunch and dinner on a day-to-day basis.
Yes.
Do you have access to food daily, or is that a trouble for you?
It could be a trouble sometimes.
Is it a trouble?
No, it's not.
Okay.
I have access.
Okay. If you don't have access to food, there are financial resources that we can provide for you so that you have access to food and water. Okay?
Okay.
All right. So how about your eyes? Do you have any visual problems? Do you wear glasses or corrective lenses?
No, I have no eye issues.
No eye issues. Okay. When was your last eye exam?
That's a good question. Probably when my last physical was.
So 7 years ago or so. Okay.
At least 7 years ago.
But how would you describe your vision? Do you have good vision? Do you have a hard time seeing it all?
Great vision.
Great vision. Okay. So no problems driving, no problems reading near or far?
No.
Okay, great. So you would say you have perfect vision then?
I would.
Okay, that's good to hear. Any redness or itchiness in your eyes at all?
Like ever, or?
Yeah, just or day to day.
I mean, not really.
Okay, sounds good. All right, moving on. How about with your head? Do you have any headaches, ringing in your ears, dizziness, seeing spots?
Not normally, no.
No, not normally. Okay. Have you ever had vertigo or anything like that? Okay. How about nasal stuffiness or nosebleeds?
I do get stuffy,
Okay.
I feel.
What would you attribute that to? Do you have any seasonal allergies or anything around your living environment that would be causing those?
Probably the terrible air quality in Bakersfield.
Okay, terrible air quality will definitely do that to you. I noticed that your address is also more rural, so you live kind of near agriculture, and when they're pollinating the trees or it's fruit trees that are in season, you can have some irritation from pollen as well. We can talk about an allergy pill for you later on that might help you seasonally to help with some of that congestion that you're feeling. And then how about your teeth? Do you have any problems with your teeth? When was your last dentist appointment?
Everything seems to be about 6 years ago. I wonder what happened in them.
Okay, so it's been some time since
It's been some time. Yeah.
Okay, so it's been some time since you've seen a dentist as
Yeah.
well. Okay. Do you have any mouth pain or any concerns with your gums or tongue or anything like that?
No.
Do you have any pain when you're swallowing?
No.
Okay. So good dentition overall, no problems with your gums bleeding or anything like that. And you brush your teeth twice a day?
Twice a day.
All right, sounds good. Would you say that you have frequent sore throats or illness?
No.
Okay. How would you describe that part of your health? Do you feel like you get the common cold often, once a year, anything like that? Or you feel like you're pretty healthy overall and you don't get sick very often?
Yeah, I mean, I rarely get sick.
Rarely get sick. Okay,
Once every
you're a lucky
8
one.
years or so.
Doesn't go to the doctor, doesn't get sick. All right, and then how about for your cardiovascular health, I want to ask you a few questions. Do you have any chest pain? Do you have any tightness in your chest, shortness of breath, coughing when you're breathing, anything like that?
No.
No? Okay. And you've never been diagnosed with any cardiovascular problems?
No.
Okay, sounds good. How about when you wake up in the morning or at the end of the day, do you notice any swelling in your hands or your feet?
At the end of the day?
Yeah.
Well, sure, yeah. If I'm
Sometimes.
walking around all day and take off my shoes, yeah, my feet are probably swollen. But
Okay.
Besides natural causes, I don't
So,
particularly have that.
so normal occurrences of
Yeah.
it, nothing abnormal.
I don't wake up with swollen
With
feet for
swelling.
no reason.
Okay,
That's
good.
what I'm saying.
And then as far as your breathing goes, you had mentioned that you do have some congestion, but do you feel like you're able to breathe pretty well? You have no, generalized shortness of breath, no phlegm that comes up daily that's colored, anything like that? A cough that you have regularly?
I mean, regularly, no.
No? Okay. Well, that's good. And then we spoke about your diet briefly. I know you don't have any restrictions, but do you ever experience any symptoms like heartburn or, GI intolerances? Sometimes, for example, people have dairy intolerances, or how you mentioned your sister has gluten intolerances. Have you ever noticed that when you eat things that have gluten in them or dairy products that you have any uncomfortable issues with your stomach?
Only Taco Bell.
Okay.
Besides that, no.
And how about bowel movements? Do you have a bowel movement regularly or daily?
Frequently.
Okay, frequently, regularly. No loose stools or anything like that, though. Normal.
Normally, it's normal, yes.
Okay, no blood or anything like that in your stool.
No.
Okay. And then when you're using the restroom while you're urinating, do you have any pain or bleeding on urination?
No.
No spasmy feeling of your bladder?
Mm-mm.
Okay, sounds good. And then no sores, masses, or anything like that. Do you do self-exams?
Do I do self-exams?
Yeah,
On
checking
what?
your testicles to check for prostate cancer or anything like that?
I don't feel anything different. I mean, I would know if there was like a lump or something, if that's
Okay,
what you're asking.
so no lumps or masses, no
No.
sores, no burning on urination. Okay, good. And then you had mentioned with your elbows and your knees, likely related to your psoriasis, that you feel some stiffness in your elbows and your knees. Is that joint stiffness often, or is it seasonal? Sometimes you only feel it in the cold, or how would you describe that pain?
I don't have joint pain in my elbows. That's where my psoriasis primarily is,
Okay.
on my skin. My knees and ankles are probably from years of running track and destroying and rolling ankles playing basketball. I don't know how much of it is actually related to
Okay, that's
psoriasis.
fun.
I've
Okay,
been told.
so do you still play basketball and do all those things to stay in shape?
Sometimes.
Yeah, recreationally you play sports and do those kind of things with friends?
Sometimes, yes.
Okay, that's good. Good way to stay active. Do you have any difficulty performing anything that you need to do on a day-to-day basis?
No.
Okay. And then you said with your elbows, you noticed that you had the plaque matches and you were diagnosed with the plaque psoriasis. Do you have any open lesions or anything that's leaking, oozing, anything like that?
No, it's very...
Nothing blistered, it's
yeah,
all just...
I would say... I mean, it's there mainly. It gets worse in the winter months when it's colder and the sun's not out.
Okay.
But after like a day or two in the sun, it's almost completely gone. So
Wow.
when it is around, it's very minimal. It's not all over my body. It's in like a couple spots.
Okay. So responds well to sun. That's
Yep.
a good sign. Yes, vitamin D is actually really good for treating psoriasis. So that's good that you noticed that. Yeah, the summer it does tend to get better. In winter months it's more irritated.
Yep.
And then as far as it goes, you said we had mentioned, occasional headaches. If you get an occasional headache, do you take Tylenol or anything like that for it?
No, I normally just drink more water. And
More water, so
put
you
an
just
ice pack on or something.
fix the hydration. Okay,
Yeah, I'm
so
not a big pill prescription pain person.
that's really good. But if you ever do have a headache that doesn't go away with extra hydration or anything like that, you're able to take about 1,000 milligrams of Tylenol every 8 hours, okay? Nothing more than 4,000 milligrams of Tylenol in a 24-hour period, okay? How about, you mentioned that this is a new job for you, so leaving one job and beginning a new job can sometimes be stressful. Do you feel like you're handling your stress okay? Do you feel like you're well supported by your family and friends?
Yeah.
Yeah, okay. When you left your last job, was it for any particular reason or you just were ready for something new? Tell me a little bit about that.
Well, I was moving. My girlfriend was having to move back to Bakersfield from San Diego, and my job wasn't really something I loved at the time, so it was a perfect storm to quit and try something new.
Okay, sounds good. So hopefully this new job goes really well for you, and if you need any other support, let us know. We have lots of resources for supportive staff, okay? How about, do you have any family history of hematologic problems? Like, have anybody in your family, are they anemic? Do they have hemophilia? Any blood cancers or clotting disorders, anything like that? Not to your knowledge? Okay. If you were to cut your finger, would you say that the bleeding stops in an appropriate amount of time, or are you concerned about the amount of bleeding when that would happen?
I guess it depends on the cut.
Okay, that sounds right. And then, have you ever had any seizures or problems with memory loss or anything like that?
No.
Any injuries where you've fallen and hit in your head?
No.
Okay. And then, as far as, we're going to go over your mental health and psychiatric. I know mental health is a very popular topic lately because it is something that a lot of people, experience and don't talk about. Have you ever experienced any stress-related anxiety or depression or anything like that?
Yes.
Okay. Which one? Stress, anxiety?
Stress-related
anxiety.
Yeah.
Would you say it's more attributed to work things that are going on, or is there anything significant in your life that's going on? I know job changes.
It's a hell of a doctor's interview for my health.
I know.
My social.
Complete assessments are pretty in depth.
No, I would say outside life. Yeah.
Outside life. Okay. And you feel like you're coping with them well, and you feel good because you said that you are well supported by your family and friends.
Sure.
Okay. If anything like that were to change, you're always welcome to tell us. We are happy to help you. We can get you resources with local therapists, and later on, if it were to be necessary, we could discuss medication options as well, okay? Okay. And then, as far as your allergies, you said you have no allergies to food or medications, but it does sound like you may be having some environmental allergies that happen seasonally because of the location that you're living currently, right?
Yeah, pretty common.
Okay. What symptoms do you experience when you are noticing those?
Mainly congestion when I first wake up. It does tend to go away throughout the day, but when I first wake up, I have to blow my nose almost every morning, and I feel like I could spit up like extra phlegm, and I don't know. It's like just a film layer that.
Okay.
Like
is it colored at all, or you just feel overall congested?
Not colored, but.
Okay.
Overall congested.
All right, that is good. I'm glad to hear that. And we can discuss starting you on a allergy medication. If you take it nightly, it will start to help relieve those symptoms that you can experience from seasonal allergies. Have you heard of that before?
I have. I'm just not sure if seasonal allergies is exactly what I have.
Okay.
If that's what I have, then yeah.
Okay.
Try to take
Yeah. You haven't had lab work in some time too, so that's something we can discuss to investigate further and see if you have any antibodies that are showing inflammation indicating that you have some allergies going on. Do you have any, residual pain or anything like that anywhere?
No, not normally.
No, you feel okay? All right. Well, I think that is going to conclude our physical assessment today. I would say that, there are some things that we can discuss that you are at risk for to just improve your overall health. Just based off of our conversation, some things that I have seen, after speaking with you, multiple of your family members do have high blood pressure, so that's something that we're going to watch out for. We'll definitely be checking your blood pressure. We'll get some new labs to see how everything is going and looking. But you are at risk for hypertension and cardiovascular disease, just based off of the family risks, because of so many of your family members having high blood pressure so closely related to you.
Would that be, well, those same family members are also hundreds of pounds overweight. Would that be still an issue I need to be concerned about? Or is that a weight-related problem that it just so happens my family members have it, but they're...
So it could be either.
Because when they lose weight, they don't have those issues when they have been skinny. It's only when they gain weight do all these health problems happen.
Correct.
So is that something I should be worried about, or just like don't eat everything you see?
Yeah, it's something to keep in mind. I would say that because your familial history is there, you are more at risk of it. However, because you are in good shape, good standing, you don't have any other health or medical problems, your risk is lower. So these, predispositions are there for you. However, you're not always going to have them based off of, your own physical stature and how you're feeling entirely yourself. You are more likely to have these things because you have the family history and connection to them. But, over time, like you mentioned, you notice that they're more likely related to, the weight that they have or, other health problems that they have.
Yeah, I don't think those issues run in my family. I think weight issues run in my family, and then these are byproducts of that.
Okay, so weight is also a problem in the family. And then, with your psoriasis, I know you said that it's typically worse in the winter, so I would say that your elbows, if you're picking at them too much, you're at risk for impaired skin integrity just from picking and scratching at the skin. So when you do have more flare-ups of the psoriasis, I encourage you to not pick at the skin, okay? Okay, good. And then, risk for exacerbation of seasonal allergies. If you have seasonal allergies that you don't take care of, you're more at risk for respiratory infections and also for developing asthma. So I'd like to also take a look at those allergy symptoms that you were talking about. We'll also look at your lab work just to make sure that we have a good, standing of where your allergies actually are, just to make sure that if it is something that you're coming into contact with more frequently, that those aren't going to cause more flare-ups for you, okay?
Sounds good.
All right, do you have any other questions today?
I don't.
All right, Mr. JB, it was very nice meeting with you, okay? And I look forward to seeing you again.
Thank you, Doc.
All right, thank you.